Dr. Bebout here. I want to do our medical word of the day, and today I think we're going to do a cardiac murmur. A cardiac murmur is an abnormal sound of the heart. It can be caused by several different things, which I'll get to here in a minute. But first, you need to understand what a murmur is. Normally, when you listen to a heart, you hear just lub-dub, the sound of contraction of the different parts of the heart. A murmur is an abnormal whooshing sound that's interspersed in with the normal sounds of the heart. Normal laminar blood flow should be soundless, noiseless, so you don't hear any abnormal sound. Pretend you have a garden hose and you're running water through the garden hose, and it's a smooth-walled garden hose, and the water's flowing through normally, smoothly. There's no sound. If you listen to the hose, you wouldn't hear anything. Now, let's kink it and form an area of turbulence in that blood flow, and then all of a sudden you can hear that flow. That essentially is what a murmur is. Now, a little bit of anatomy lesson. Your heart is made up of 4 chambers, and between those chambers are valves that prevent the backflow of blood. So your blood returns to your heart through the inferior and superior vena cava. It empties into the right atrium. Between the right atrium and the right ventricle is a valve called the tricuspid valve that prevents the backflow of blood. So then the heart beats, pushes the blood up through the pulmonic or pulmonary valve, which allows blood to go up into the pulmonary artery and out to the lungs. Blood is then reoxygenated, sent back to the heart through the pulmonary vein, and then it goes into the left atrium, and then the left atrium is divided from the left ventricle by the mitral valve. Then it beats, and the blood shoots out into the aorta to be fed to the body, and that goes through the aortic valve. You can have problems with any of these valves. If the valve is too tight, it's called a stenotic valve. If a valve is too loose, that's a regurgitant valve. So you can have mitral regurgitation, aortic stenosis, those kind of things. Those are all called murmurs that sound different and can be identified on exam. You can also have other causes of murmurs. You can have holes in your heart, like a hole between the ventricles is a ventricular septal defect. A hole between the atria is an atrial septal defect, or a patent foramen ovale. And then there's a blood vessel that sometimes doesn't close in children, and that would be a patent ductus arteriosus. Other things can cause murmurs, tumors, infections, those kind of things, but they're not as common. One thing that you will see that's often picked up in children, especially during sports physicals, you'll pick up a murmur, and that's called an innocent murmur. And it doesn't mean anything, and it doesn't cause any problems. Where the problem comes down with heart murmurs is you don't know exactly what the problem is or how serious it is. So it has to have further testing. And that a lot of parents don't understand when we stop a sports physical and say, we can't continue until we identify what this murmur is and see if it has a potential problem. So murmurs are complicated things, and it's a complicated concept, but that is a brief, short explanation of what a cardiac murmur is. I won't go into complications and treatments and stuff like that. I just wanted to share the basic description of what we're looking at. So there's our medical term of the day. That's a cardiac murmur. I hope y'all have a great day.